Assalamualaikum, selamat pagi, and a very good morning to all of you.
Selamat pagi.
Okay, right. Now, initially when I was invited to give this talk, I have actually given a very different topic. Yeah, the topic that was given was actually based on NCDs, non-communicable disease. But then having, gone through your website to check, on what are the various topics in this conference, so I found this topic, SRH, sexual and reproductive health. So I thought, it's best for me to present a more juicy topic. And this is where, I came up with the idea of talking about sexuality education, which is, which is actually my, research forte. So my research forte is basically based on sexual and reproductive health. Now, first of all, before I proceed to the lecture proper, my deepest gratitude to the faculty and to University Negeri Malang for inviting me here to this beautiful city of Malang. This is my second visit here, and I love Malang. Now, we have lots in common. University Negeri Malang, right? Right from the beginning, opening speech, you call yourself UM. In Malaysia, University Malaya is also called UM. So we have lots and lots in common. So all the more, I think there should be further collaboration between both our institutions, yeah, especially as far as public health and physical education are concerned. Yeah, not only, just for the sake of, education and whatnot, but in terms of collaboration, in terms of students exchange, academic exchange, and of course, at the end of the day, the goal is to improve public health in the whole, region, not just in Indonesia or in Malaysia. Right, let me now quickly move on to my lecture proper here. So I cannot control my slides here, is it?
Yes, you can.
Okay, right. Right, now this is how, talking about adolescent, yeah? So my topic is actually based on adolescent. And this is how, international organizations define what adolescence is, yeah? So adolescent is from age between, 10 to 19 years of age. Youth is considered from 15 to 24 years old, and young people is from 10 to 24. So my lecture actually involves, this age group, yeah, between, when I talk about young people, it's between 10 to 24. So all these are international definition of what adolescent, of what youth, of what young people is all about. Right, now it is actually a period of transition, as you can see, transition from childhood, into adulthood, yeah? So very much so, the exploration, of your own bodily changes of what, any adolescent would go through, yeah? And I think it's very important in relation to, SRH issues, sexual and reproductive health issues, if they are poorly informed of sexual health, sexuality matters, then I think, it might affect, their decision making and also their lifestyle changes as well. So I think if they do get information, whether that information on SRH is reliable. These days, in this day and age, technology, digital age, and what have you, most kids actually go to the internet to look for sources, yeah, of information. But the question is, whether that source is reliable or not is entirely a different matter. So as much as possible, being educators, we want to provide them with, the most accurate information, yeah? And so if they are poorly informed, that means that, the information that they gather, might not be well enough, to actually protect their own sexual health. And of course, with that, inappropriate information that they receive through the internet, for instance, they will be susceptible to unwanted pregnancy, health risks associated with early pregnancy, unsafe abortion, sexually transmitted diseases, HIV and AIDS, okay? Right. Now, why adolescent is, a concern to us? Because adolescent is a demographic, force. I think in most, if you look at the population dynamics of most country, yeah, the major population in a country is actually the adolescent, yeah? So that is a dynamic force. And of course, it is also an economic force, yeah, where families, communities, here, they are into the workforce, whether it's paid or unpaid labor, okay? So actually there is a contribution towards the economy of any nation. And also they are our future, adolescents are our future, and we do need to think in terms of their future health. Yeah, the formative age, where they are provided with the appropriate knowledge and skills. Most important are the skills that we talk about here, to shape, their health, their behavior, and their attitudes. So of course, as the issue of sexual and reproductive health, they have the right to the knowledge, very important, yeah? We recognize that adolescents have the right to the knowledge and the right to participate in any decision making as far as SRH issues are concerned, all right? Right. Now this is a changing phenomenon, as you can see here. There is a delay in marriage. I'm not sure about the situation here in Indonesia, but back home in Malaysia, the age of first marriage has actually increased. Yeah, now I'm sure most of you would realize that Malaysia is a multicultural society. Yeah, for the Chinese, Malaysian Chinese, the age at first marriage is actually early 30s. Yeah, followed by the Indians. Indians will be, late 20s, and then the Malays. Yeah, so those who get married earliest would be the Malay population. Yeah, followed by the Indians and then the Chinese. So there is a delay in terms of age of first marriage. Why? It's because, people, because the influence of education and what have you, women are being, educated, and so therefore sometimes they postpone marriage. And also you have a number of unmarried youths, increased. It increased because of the status of women, and we have more educational opportunities for female girls. Yeah. The effect of urbanization and modernization as well, changes in the lifestyle, okay, and our values change according to the society, according to time, yeah, so their values, their priorities might entirely be different, as compared to those days, our parents' days and what have you. And of course, less parental supervision. When you want a proper education, sometimes you go to the big city where proper education are, the more opportunities are there. And once they moved out, of their villages or their kampong or what have you, and you get less parental supervision. And of course, living arrangement as well. Yeah, they may be renting an apartment out in the city, or they may sharing it, with their peers. And of course, the influence of youth culture, more opportunities for social interaction. Once they are on their own, perhaps in the city, the mingling is different, social interactions are different, and so I think all these, changes their lifestyle, right? Okay, so adolescent pregnancy, it has been shown. Most adolescent girls between 15 to 19 get pregnant, and pregnancy among very young adolescents is indeed a very significant problem to us. And the context of adolescent programs are not always the same. Now, it differs, it depends on the culture you are in. If you are going to a certain culture, which is very conservative, very restrictive in terms of religious belief, then I think the way you deliver that education will be entirely very different, all right? And also adolescent pregnancy, it's dangerous to the mother herself, and not only to the mother, but also, to the fetus, And of course, it also adversely affects the community, the population. Yeah, so this is some of the issues that we in Malaysia also faces. Right, now the consequences of early pregnancy, as you can see here, for the self, for the person, for the adolescent herself, will be the risk of complication for pregnancy, that means unsafe abortion. Now, back home in Malaysia, majority are Muslim, so abortion, is kind of illegal, provided it's only for medical abortion. Only the doctor, the GP can decide whether a woman should have an abortion or not. So, and because of that, the availability of abortion is not freely available, so sometimes the kids goes out to certain, a GP that are not licensed to have abortion, and they will do it there. So, of course, all these unsafe abortion causes, some negative consequences. And it might lead them to single or early motherhood, So we have all these juvenile homes, where kids, who get pregnant, and they're kicked out from school, and therefore they have nowhere else to turn to. They will go off to these shelter homes. So they become mothers at a very, very early age, in their teens, And of course, there will be school dropout. They have to stop, their education. Now, it is not the Ministry of Education Malaysia's policy to kick them out. We don't kick a student out from school if they're pregnant, but ultimately the student themselves, will discharge themselves from school because of embarrassment, because of stigma and what have you. So they themselves then would ask to be dropped, from a school. They would terminate their schooling, all right? And so that would be, might be the end of their, career. There will also be diminished employment and income earning opportunities. If they're working, then they have to stop, they have to deliver the baby, then only can resume back their work in the workforce. And of course, responsibility, pressure of child bearing too soon before, they even have their own career. So I think all this comes too fast because it is unplanned, it is not wanted, all right? And of course, the potential for self-development, it's being curtailed. So sometimes, they want to have, fantastic ambitions and what have you, and because of this unwanted pregnancy, unsafe abortion that they are going to, this might hamper, their future development, all right? All right, now these are the consequences of sexual relation health risks here. You can see childbirth, they might land up with premature labor, they might land up even getting married, and miscarriage or stillbirth. And of course, no parental care, family support, and they only seek their pregnancy rather late. It's because, they are ashamed of themselves, for being pregnant, and some of them are not even aware that they're actually pregnant. So if they were to seek, healthcare help, services, they will go at a very late stage of their pregnancy, all right? And this can be a danger to them. Of course, other medical issues, infections of the reproductive tract, and STI, sexually transmitted diseases. Now, as we all know, HIV and AIDS, occur, half of the infection actually occurs in people less than 25 years of age, okay? So there's something that we need to reckon with. And of course, issues of unwanted pregnancy, abortion, child abandonment. Back home in Malaysia, it's a serious problem. We have what we call baby dumping, So when they deliver the baby, they don't know where to put the baby, so they just dump them into a rubbish bin and what have you. So that is a social problem for us, So the Ministry of Women, in fact, has come up with a program, where they put a hatch where if the baby is out, they just put the baby there, so that then the authority, the bell will ring, it's connected to the authority, and the authority will then come and collect the baby, So they don't know who the mother is. So this is just an avenue for them to dump their baby should, the event happen. And baby dumping, sometimes is due to promiscuity, And of course, the other aspect is sexual abuse, incest, and rape. Okay, so here again, from a macro perspective, so those are individual, what it can do to you, to your own self. But from a more macro perspective, from a national perspective, population perspective, you have a higher, infant and mortality rate, higher healthcare costs, So they may be admitted to the hospital, and the medical cost has to be incurred. Abandonment of newborns, reduced human capital for social economic development, and increased dependency of young mothers on the male provider. Okay, so these are from a more macro perspective. Now, this is to show you why there is a need for sexuality education. So these are some of the data, international data, from UNAIDS. So distribution of HIV, you can see here, The green, it's adults, 25 years. And you can see here, these are children under 15, the blue, The red are young people 15 to 24. So you can see, as the age increases, the new HIV infection being contracted. So both young men and women need SRH education, including information on sexuality, contraception use, family planning techniques, reproduction, abstinence. Now, the Ministry of Health Malaysia policy is abstinent, all right? I'm a very strong advocate for sexuality education, so sometimes we will sit with our ministry people. Yes, we do respect their policy on abstinence, but bear in mind there are certain groups who do not want to be abstinent. So the question is, what do you do with this group who do not want to be abstinent? So that is a group that you need to reckon with, you need to deal with them, all right? Because not everybody wants to be abstinent, okay? Like I said again, age of marriage has actually increased until early 30s, yeah? Those who are reaching early 30s, don't expect them to be abstinent, all right? And you can't force people to be abstinent, yeah? It's their choice, yeah? They have the right to decide what they want and what they do not want as far as their sexual health, sexual life is concerned. And adolescent sexuality is indeed a very controversial, very sensitive issue, particularly, I don't know about Indonesia, but back home in Malaysia, whenever we devise, we can't even use the word sexuality, all right? So if the ministry, if the government were to do anything that's related to sexuality, we call it social education, reproductive and social education. But actually it's sexuality education, yeah? But because the word is so sensitive, it's very controversial. All right? So this is something, you know, that we need to deal with it. And also the other issue back home in Malaysia is the religious aspect. Yeah, like I said again, majority are Muslim. So whenever you devise this program, it has to go to JAKIM. JAKIM is Jabatan Agama Islam. So then we'll work through the whole curriculum, yeah, you know, to make sure the religious component is actually included in the curriculum. So that is something that we need to deal with, the religious authority, all right? It is not an impossible task, for as long as you sit with them, you make them understand, and I think, you know, they are okay with the curriculum. It's just that they need a recognition that the program has actually gone through JAKIM, Jabatan Agama Islam. So it's a sensitive subject. In all the cultures, program that offers SIH services, you know, can expect, of course, resistance from the community, particularly the religious association, right? So there is also a need for counseling of youth, yeah, of adolescents, of young people in terms of sexuality, pregnancy, and abortion issues. And whatever we are doing, we should develop, you know, sexuality education kind of program. It has to be age appropriate, depending, you know, on the age of the adolescent. Yeah. So what we do is we give them from very young. We start with very small doses, yeah, until a high dose when they reach, you know, the older adults. So the program is basically on skills. It is not just knowledge, yeah? And knowledge, they can get it anywhere. Like I said again, you go to international website, you know, knowledge is always there. In these days, you know, in the day of age, you know, with technology, internet, and what have you, people are very good at digging up information through the internet. But what they require is the skill to be able to make the right choices, yeah, in their life, okay? Such as negotiation skills, assertiveness training, this is what we provide them. How to say no, refuse unwanted sex, insist on condom use, to make informed choices, and how to resist unwanted peer, you know, all the pressures that they have. All these are skills that you need to teach the adolescent. It's not so much the knowledge, but moving on to skills, you know, imparting the right skills, teaching them how to negotiate, yeah, in a social, you know, interaction, yeah, or saying no, you know, to all this social pressure. So those are something that we need to do, you know, for the adolescent. So really there's a need for us to increase awareness, yeah, of the threat of sexual violence. I think if you go out on a date, sometimes, you know, you can get violence, yeah, or even gang rape and what have you. To empower the youth to protect themselves, yeah, from or take appropriate actions against perpetrators of sexual violence here. And also to understand any misconception and myth in different cultural settings. So there are lots of myths out there, so I think our job here is to demystify those you know, conceptions that they may have, yeah? And I think that's part of our role here. And we need to counter, you know, gender-related double standards. Yeah, I think in most of our society, I mean, even here, you know, we are still very conservative, so there's always a double standard. Yeah, or only the guys can do it, you know, the female, you know, we cannot do it, yeah? So I think all this double standard needs to be addressed. And of course, a need for parental role. So very important when we talk about sexual education, back home in Malaysia, they say that, yeah, that's the job of a teacher. You go and ask the teacher all these questions, the teacher can answer. But where is the role of the parents? So here, as much as possible, we want to educate parents, yeah, in taking the responsibility in educating their kids as far as sexual matters are concerned. So it is not just a domain of the Ministry of Education, But in the home as well, the role of the parents are equally important, yeah, to provide, education on sexual issues. All right, so sexuality education is indeed a solution. Here, I'm moving on to illustrate, yeah, should you build any sexuality education program, there is a revised version on technical guidelines in developing a very comprehensive sexuality education. Yeah, the latest revised version was last year, 2018, by UNICEF. So whatever program, that you're devising, as far as sexual and reproductive health issues are concerned, do refer to this report. You can download, go to the website, UNICEF website, and this is the technical guidance in teaching you how to develop, what are the components that you have to take into consideration when you're devising that curriculum, all right? So basically here, under UNICEF here, the guideline is called International Technical Guidelines on Sexuality Education, all right? So it's a technical guidelines, yeah, that actually helps you to devise education. So the goal here is for the children and young people become equipped with the knowledge, skills, and values. So here the knowledge, skills, and the values, yeah? Okay, to make responsible choices about the sexual and social relationship. So basically, sexuality education programs to increase one's knowledge and understanding, to explain and clarify any feelings, that you may have related to sexual issues, the values. Sometimes you may have very contrasting values. You have your own personal values, and here you have your own religious values and what have you. So those kind of conflict within yourself needs to be sorted out, all right? And to develop strengths and skills, very important. What we are trying to empower, our young folks, young kids, yeah, is to provide them a skill, so they can then, use the skill, to improve, their personal development as far as sexual issues are concerned. And of course, to promote and sustain risk-reducing behavior, for instance, HIV/AIDS and what have you. All right. Now, last year we have this project from our own Ministry of Women. Yeah. So I was one of the consultants for this, and we have actually developed this software that is meant for the young people, yeah, adolescent. So we call this program the ACE program, Accurate, Comprehensive, and Effective Sexuality Education. All right. Let me quickly just walk through with you. Yeah, so that's the program that we have. It's hyperlink. Can you just click it on the red one? Pseudo hyperlink, you click it. Doubling. Loading, okay. We just developed this in 2018, last year, yeah? So now it's in the public domain. Any public can actually use it. So it comes in two versions. We started off with the English, yeah, and also Bahasa Malaysia. So for people who is more fluent in Bahasa Malaysia, they just click the version Bahasa Malaysia, and everything comes out in Bahasa Malaysia. If those who are in English, who is well-versed in English, so you just click the version the English, all right? Just give me a minute. It's downloading. Right, so this is the website, yeah? Now, it's public domain, yeah? You can even go in, yeah? So we call it the ACE, yeah? ACE, Reproductive and Social Education. You see, this project is funded by Ministry of Women. We can't even use the word sexuality. Yeah, how else are we going to address sexual issues? So that's the thing that, we still need to address, yeah, back home in Malaysia. So here, our program is called Reproductive and Social Education. So we have the English version and we have the BM version. Could you click the BM version, please? Right, so these are our topics. We have actually 12 topics here. So now, can you scroll it? Yeah. Say like, for instance, you can click on anyone. Just click on anyone. Yeah, the topic comes out. Yeah, this is topic number 6. Yeah. So daripada lelaki remaja menjadi lelaki dewasa. So all this information, yeah, so we have an introduction. Could you scroll it down? All right, and then next. Okay, so we gave introductory, first of all, we start with, what is relationship, to them, what is the concept of relationship, and what have you. Just keep scrolling. All right, and then next. All right, so forth and so on, yeah. So this is tanggung jawab, lelaki dalam hal-hal keluarga. So this is their responsibility. So as far as boys is concerned, in this particular chapter, in this topic, yeah, we want to educate boys as well in terms of their role, yeah, in this whole sexual relationship. Okay, and so that is, so that's the whole module, yeah. So we have the English version and we have the BM version, and so this is public domain, yeah. So anybody can actually get in to look at it. All right, thank you. Okay, moving on to the PowerPoint slides. Yeah, carry on. Okay, slideshow. Yep. Okay, teruskan di bawah. Okay. Next, okay. Now this is the content, now based on the UNICEF, the UNESCO one, the International Technical Guidelines, if you're developing any sexuality education program. So these are the topics that they have here, the concept of sexuality education. So you must have a session on relationship, you must have a session on understanding what gender is all about, on values, on rights, culture, and sexuality. You must have a session, a topic on violence and staying safe. Skills for health and well-being, and the human body and development, sexuality and sexual behavior, and of course the whole general SRH issues. Okay, so this is their guidelines, and these are some of the concepts that you will need to incorporate into your program. All right, so to give you an overview of the key concept, topics, and learning. So for each, let's say you're looking at relationship itself, you will need to talk about families, you will need to talk about friendship, love, romantic relationship, tolerance, inclusion, and respect, and long-term commitment and parenting. So for each of these concepts that they have in the technical guideline, so these are the things that you need to deal with it, all right? You need to include it into your own curriculum. Okay, so that's it. And the quality characteristics of sexuality education would involve this. In the preparatory phase, this is what you need to do, yeah, basically in terms of theory, yeah, and then the content development, what you need to focus on, yeah, addressing the consent and life skills. So they actually teach you how to actually devise your own program, okay? Right, I think that's my last slide. So WHO has demonstrated that when properly conducted, sexuality education leads to delayed sexual activity or an increased use of safer sex practice and not earlier sexual initiation. Very important, I think people are very skeptical, authorities are very skeptical if they were to initiate sexuality education, for fear that the minute, I have this lecture on sexuality, the next thing is going to happen, they are going to go out of this room and practice it, all right? So all these are evidence-based, yeah? So this is what WHO has conducted a study in 27 countries, and this is what they have shown, and this is the results of, conducting sexuality education. All right, and that's my last slide. Last but not the least, this is my most favorite slide. How many of you have seen this journal? Yo, how many of you have seen this journal? There's only one? So two, so it looks like I have failed my job as an editor in this journal. Right, now, this journal, Asia Pacific Journal of Public Health, it's both in text in Scopus and ISI, WOS, yeah? And the journal is owned by APAC, Asia Pacific Academic Consortium for Public Health, okay? So it's owned by the society, not owned by University of Malaya. I, being the editor-in-chief, is based at University of Malaya, so normally the journal follows the chief editor, all right? Okay. APAC hosts an annual conference, public health conference, every year. Last year, it was held in Sabah, East Malaysia, hosted by University of Malaysia, Sabah. This year, it will be in Bangkok. Mahidol University will be the host in November. Next year, it will be by University Air Lanka in Surabaya. So the conference next year in November will be in Surabaya, yeah? And the host is University Air Lanka together with the co-host, Universitas Indonesia. So they are the one. Can you double click on that? Thank you.